Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y cero en su teléfono ahora.
AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. This week, Americans are taking time to pause and reflect on the 20th anniversary of the September 11th attacks. Of course, these days, the daily threat on most Americans' minds is the surging COVID-19 pandemic. As the impact of the Delta variant grows, so do concerns about safety, both at home and at work. Many older adults have questions and concerns related to vaccines, boosters, caring for and protecting their loved ones, and navigating the changing workplace. Today, we'll hear from an impressive panel of experts about these issues and more. If you've participated in one of our teletown halls before, you know this is similar to a radio talk show, and you have the opportunity to ask your question live. For those of you joining us on the phone, if you'd like to ask a question about the coronavirus pandemic, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion about the global coronavirus pandemic. We're talking with leading experts today and taking your questions live. To ask your question, please press *3. And if you're joining on Facebook or YouTube, you can post your question in the comments section. We have some outstanding guests joining us today, including a medical expert, another on caregiving, and a business coach. We'll also be joined by my AARP colleague, Jean Setzven, who will help facilitate your calls today. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member. Or if you're joining on Facebook or YouTube, place your question in the comments. Now I'd like to welcome our guests. Oliver Tate Brooks, MD, is the Chief Medical Officer for Watts Healthcare. He is the past president of the National Medical Association and past president of the California Immunization Coalition. Welcome back to the program, Dr. Brooks.
Thank you, and happy to be back, Bill.
All right, we're happy to have you. Also joining us today is Warren Hebert Jr., a doctor of nursing practice, a registered nurse, and a nursing professor at Loyola University of New Orleans. He is also the CEO of the HomeCare Association of Louisiana. Welcome back, Dr. Hebert.
Thanks, Bill. Good to be with you again.
All right, great to have you. And finally, Chester Elton. Chester Elton is a business coach and best-selling author of Anxiety at Work and Leading with Gratitude. Welcome to the program, Chester.
Oh, delighted to be here. Thanks for having me.
All right, we're delighted to have you. Let's get started with the discussion. And just a reminder to our listeners to ask your question. Please press *3 in your telephone keypad or drop it in the comments section on Facebook or YouTube. Let's get started. Dr. Brooks, as the COVID cases climb, there are more breakthrough cases fueled by the Delta variant. How is COVID different for someone who is vaccinated versus someone who is unvaccinated?
All right, so let's look at it this way. Let's start with getting COVID. If you are vaccinated, you are less likely to get COVID. There was a study coming out of Seattle data that showed that the rate of COVID cases was 10 times higher in those who were not fully vaccinated. So you're less likely to get it if you are vaccinated. That being stated, there are breakthrough cases that are happening. So what I would say is this. First of all, if you get COVID and you're vaccinated, you get virus in your upper airway, your nasal passages, about at the same rate as someone who is unvaccinated. However, what happens when you're Unvaccinated, that virus can spread through your body. When you're vaccinated, your body attacks it and clears it. So you are less likely to spread it because you have it for a shorter period of time if you're vaccinated. Now to the actual question, if you get COVID and you are vaccinated, you are less likely to die or to get hospitalized. And there is some data, which is interesting for me, you're less likely to get long COVID, those symptoms that happen months or years later. So the bottom line is be vaccinated, even with these breakthrough cases.
Yeah, thanks for that. That was a very clear explanation. Dr. Brooks, another question for you. We're seeing a return to shortages of hospital beds and oxygen as a result of the Delta variant. What expectation should someone have if they or a loved one needs hospital care for something other than COVID?
What I would say is this. They will likely be okay, but it's very regional. There's data showing that ICU beds or hospital beds are full of COVID patients in certain states where there's a high rate of COVID versus other states where it's not quite as bad. I literally left the hospital this morning and I asked, and I was told that we have beds. So I would say that based on where you are, you will likely be able to get care. The problems that we had at the peak of the pandemic at the beginning of this year are not as bad on the hospitals based on your region. So if you go to a hospital, you should get good care.
I mean, we're hearing about people having to wait many, many hours to get care for non-COVID related afflictions. Is that you're saying that's just a regional phenomenon and people should no doubt check with their hospital before they go?
Exactly, because even within states, it'll be one city may have a shortage of beds, perhaps a shortage of oxygen. Another city within the same state may not.
So should people skip an elective surgery? What about a flu shot or routine care? Should they put those things on hold?
Yeah, so let's start with the first one. I would say elective surgery, do it, because if you think about it, as this Delta variant is increasing the number of cases and the number of people hospitalized, if you put it off now, you wait till, let's say, November, it may be worse. So I would recommend getting an elective procedure done now. A flu shot, absolutely get your flu shot. Could you imagine a patient having influenza and COVID-19 at the same time, both primary respiratory diseases? So you do definitely want to get your flu shot. And then routine care, what happened, a lot of routine care was delayed when the pandemic was at its peak, and we physicians were doing primarily televisits or no visits. So I would say, again, right now, get your routine care. Just keep in mind, right now, the rates are on an upswing. So if you don't get it now, and again, you wait, you may not get it for another 6 months. So absolutely, go get your routine care now.
Okay, thanks for that, Dr. Brooks. Dr. Hebert, let's turn to you. Over the past year and a half, the pandemic has posed a big challenge for family caregivers. In some parts of the country, Hurricane Ida and wildfires have only added to the challenges that caregivers are facing. What's the impact of the recent COVID surge on top of these incredibly tough conditions?
Thank you, Bill. The challenge related to the percentage of folks who are vaccinated here in my state in Louisiana, there are about 40% of folks who are fully vaccinated. The implications that has for Hurricane Ida is that people are moving to shelters, or they're moving in with family and friends because their homes are no longer habitable. And for the high percentage of people who are unvaccinated, if you just lost your home, you're really not going to be thinking a lot about masking or distancing. That's going to be well down on your priority list because of the issues you're dealing with and the trauma around a hurricane or a wildfire. So I'll certainly go back to Dr. Brooks' comment about the importance of vaccinations in the midst of a traumatic event like the situations with hurricanes and wildfires. Being vaccinated makes your decisions so much easier. The challenge that we also have here in Louisiana, unlike some of the other areas, is that the rural hospitals, critical access hospitals, were already really at the verge of failure in their system. So as a result, rural hospitals that typically would send their patients who are ICU-type patients to urban centers where there are ICUs, ventilators, and ICU competent nurses. The fact that the rural hospitals can no longer send folks there has been a real issue for the rural hospitals. When you add to that, in our case, Hurricane Ida, and the fact that so many of those hospitals that were in the path of the storm are no longer in operating condition, and it's going to take a while for some of them to come back online. So that further adds to the stress with hospital systems, and I suspect the same thing is true for our friends that are dealing with wildfires.
Yeah, it just adds to the burden of family caregivers, I imagine. I mean, now you're wondering where can I take my loved one? What kind of medical care is even going to be available?
Yeah, the family caregiver certainly has enough a challenge and a significant burden just in typical times. Circumstances have moved me in with my 89-year-old mom, which has been a real gift for the two of us. But when we were preparing for Hurricane Ida, the decisions that we were trying to make related to the storm, whether we evacuate or not, which direction is the storm going to go in? And if we do evacuate, who do we evacuate with? And if some family members are vaccinated, then that makes it an easier decision because Mom and I are both vaccinated. So again, this challenge of the family caregiver who already has a pretty significant burden, it adds to that because of the high degree of vaccine hesitancy in many parts of the country.
Okay, thank you for that, Dr. Hebert. I'd like to bring Chester into the discussion now. Recently, Delta Airlines announced that they're going to charge unvaccinated employees an extra $200 per month for health insurance and require weekly testing. Do you think this will incentivize employees to get their shots? And is this a model for other large employers to follow?
Bill, it's such a great question because large employers are really trying to figure out how many carrots and how many sticks, right, is it going to take? And because you're a private employer, of course, you can mandate things, conditions of employment. You have to pass a drug test. You have to have a background check and so on. My son is about to work for a big financial company, and the background checks and the research they do on him is really quite extensive. So I think this is an extension of that. But the problem with it is that this has become such a politically charged and socially charged issue that you have to be careful how to do it. Now, Delta has done this, I think, for two reasons. One is insurance costs are going to go up if more of their people get COVID. I mean, that's just a reality. And so it's an incentive to reduce your health care if you're not vaccinated, right? It's also a kind of a nod to their employees that are vaccinated, kind of a, hey, good for you. Your health care is not going to go up. Whether the punitive model is going to become a mandate, I'm not so sure. I will tell you, though, that big employers are rapidly moving towards, if you are going to come into the workplace, we need to see proof of vaccination, and that is going to be a standard part of your employment contract. Now, the question is, if I'm working remotely, do I need to get vaccinated? I'm not coming in. So there's all these variations on the theme. And I'll tell you what's fascinating. We just did this massive research on anxiety in the workplace. The number one cause of anxiety is uncertainty. What is required of me? So whether you're using the mandates, increasing healthcare insurance, whatever it might be, the clear message is to have a clear message with as little ambiguity as possible. So people know what they're coming into if they're going into the workplace. They know what the financial burden might be. And you know what? It's a tricky dance, Bill. It really is.
Mm-hmm. Yeah. Have you seen large employers opting more for sticks or carrots and trying to get their employees vaccinated?
Well, it's interesting. I think, the government has offered lots of carrots, right? The vaccination is free. You can go anywhere. A lot of employers, work at home and so on. I think a lot of employers have exhausted the carrots. And now to get over that hump, they're bringing out the sticks and saying, look, if you're going to work here, you've got to be vaccinated. Now, if you don't want to get vaccinated, that's okay. You just can't work here, right? So I think you're going to see a lot more sticks and mandates in the coming months.
Okay. Thank you very much for that, Chester. And as a reminder to our listeners, to ask your question, please press *3. And we're going to get to those live questions shortly. But before we do, I wanted to bring in Kristin Dillon. Kristin is the Senior Vice President of States and Community Engagement here at AARP. Welcome, Kristin.
Hi, Bill. I'm happy to be here.
All right, happy to have you. In addition to sharing the most current coronavirus information, we'd like to take a few minutes to update our listeners on important issues facing Congress and how AARP is fighting for them. Kristin, this week, congressional committees are working on some bills that will directly affect older Americans. Can you tell us a little bit about that?
Yeah, of course. This week's big three include prescription drug prices, new Medicare benefits, and caregiving. So first, AARP is fighting to stop unfair prices for prescription medication. Brand name drug prices in the U.S. cost 3 times more than in similar countries. Yet Medicare is barred from bargaining for lower drug costs. So AARP is urging Congress to give Medicare the power to negotiate for better prices. Second, Congress also has an opportunity to fill coverage gaps in Medicare by adding dental, hearing, and vision benefits, which AARP also supports. Third, AARP is advocating to help address the financial challenges of working adults caring for a loved one by urging Congress to pass a new federal tax credit for eligible family caregivers.
Okay, those would be enormous changes and great benefits to a lot of our listeners and consumers around the country. Thanks for updating us on those. Shifting gears, this weekend marks a sobering milestone in America. With the 20th anniversary of the September 11th attacks, we'd be remiss not to pause and remember. Is there a positive way to do that, to put thoughts into action?
Yes, there are things we can do and ways everyone can help. September 11th is now a federally recognized National Day of Service in the United States. In fact, 9/11 has grown to become the nation's largest day of charitable service.
Does AARP have anything planned for this day of service?
Yes, AARP is involved. Community service has always been at the heart of our mission, but we pay special tribute every year on 9/11. So tomorrow, AARP staff and volunteers will be serving in their own communities, packing meals, supporting nonprofits, caring for others. With COVID, we can't gather in large groups, so volunteering may look different, but the spirit is the same, and the work is more important than ever.
AARP was founded in service, wasn't it?
Yes, it was. Service is a cornerstone, and that foundation is quite a story. More than 60 years ago, our founder, Ethel Percy Andrus, discovered a retired teacher living inside an abandoned chicken coop. After retirement, the teacher couldn't afford safe housing, and when Ethel saw her poor living conditions, she felt compelled to do something. So she decided to commit her life to fighting injustice and transforming lives. That's AARP's origin story, not a boardroom, but a chicken coop, with one person determined to create change. Ethel founded AARP with a motto to serve and not be served. And that motto still guides us today.
It's a wonderful story. If others want to volunteer for September 11th or beyond, are there ways to help and still stay safe during COVID?
Absolutely. There are plenty of ways to help, even virtually or from your home. AARP has lots of ideas on our volunteer website, createthegood.org. Create the Good has local volunteer opportunities in your area and also has a special section on volunteer opportunities you can do from home. So there are ways to stay safe and still help for anyone who would like to do so.
Createthegood.org. Very good. Thank you so much, Kristin, for sharing the legislative update and for being with us today.
Thank you for having me.
All right. It's now time to address your questions about the coronavirus pandemic with Dr. Oliver Brooks, Dr. Warren Hebert, and Chester Elton. Please press star 3 at any time on your telephone keypad to be connected with an AARP staff member to share your question live. If you'd like to listen in Spanish, press star 0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
Okay, now I'd like to bring in my AARP colleague, Jean Setzven, to help facilitate your calls today. Welcome, Jean.
Thanks, Bill. Delighted to be here.
All right. Let's take our first caller.
All right. Our first caller is Elsie from Wisconsin.
Hey, Elsie. Welcome to the program. Go ahead with your question. Hi, Elsie. You with us? Hi, Elsie. Go ahead with your question.
I'm going to be 90. Should I have my vaccination?
I'm sorry. Say that one more time.
I'm going to be 90 years old.
Oh, fantastic. What's your question for us today, Elsie?
Do I need that vaccination?
Well, I would venture to say yes, but I'm going to let Dr. Brooks give you a more fulsome answer to that. Dr. Brooks?
Excuse me, as you stated, Bill, the answer is yes. If she's turning 90 and more, all goodness to you, Elsie, for living such a long life. If you are 90, you're in an age range that is more likely to have complications from getting COVID-19. So you should absolutely get vaccinated. And then another thing I will say, Bill, it's never too late. So I think that's important. She should get vaccinated with whatever vaccine is available and do it as soon as possible.
Mm-hmm. Very good. Thanks for that, Dr. Brooks. Okay, Jean, who is our next questioner?
Our next questioner is Ellis from New Jersey.
Hey, Ellis, go ahead with your question.
Yes, hi. My question is, I'm a substitute teacher, and I was home for a year and a half because of the pandemic, and my unemployment benefits ran out. So now I'm considering going back, but even though I'm vaccinated, I got my 2 shots in March, but I'm still concerned about breakthrough infections, possibly, and coming down with COVID despite being vaccinated. What should I do, or should I be concerned, or what measures could I take?
About heading back to the classroom, you mean?
Yeah.
Yeah. Dr. Brooks, do you want to field that one?
Certainly. Here's what I would recommend. First of all, again, we much appreciate teachers. These children have missed a full year, or plus minus. They've missed a lot of time of being in the classroom, and that's part of learning, the socialization. What I would say is, again, if you're vaccinated, you have a much lower chance of getting COVID, getting sick from COVID, dying from COVID. That being stated, when you go into the classroom, you should follow infection control procedures as best you can. Wear a mask, wash your hands frequently, as best as you can, keep a 6-foot distance. And then a lot of the school districts have a formal testing protocol. So follow the formal testing protocol of your school district, which is for both the teachers, the administration, and likely for the students also. I think that it's crucially important to get the schools going again. And so I think it is reasonable for you to go back into the classroom.
Chester, let me bring you into the discussion here. Ellis is a teacher, but many employees around the country in different industries are having the same kinds of concerns. Do you have any advice for them? Any questions they should ask their employers?
Absolutely. Again, I love the advice of Dr. Brooks. Follow the protocols that are in place where you work. And listen, ask lots of questions. It's really interesting. I was thinking the other day, when you get a new job, you plan out your commute, where you're going to do lunch, and you fill in all those blanks. The same thing should be true when you're going back to work. Ask lots of questions. Do I need to wear a mask? Is there social distancing? Do I have to bring my vaccination card? What are the protocols so that you go in really informed? Anxiety and stress levels go up when you just are uncertain about what's going on. Are the other people vaccinated? You know, what's the percent of vaccination? All those questions are fair questions, and your employer should be easily able to answer those things. And once you know that, you know where you're going to be able to have lunch. You're going to know what your hours are, what your commute is. I think that brings your anxiety levels down quite a bit, and it allows you to more freely interact with your coworkers. You know where it's safe, and that's my recommendation. Ask lots of questions, know what the rules are, and abide by the rules.
Okay, thanks very much for that, Dr. Brooks and Chester. Jean, let's take another question.
Our next question is coming from Lana of Massachusetts.
Hey, Lana, welcome to the program. Go ahead with your question.
Thank you. My question is in response to an article that was in the Loyola Sun that I think they might have got the study also from an article that was in the Boston Herald or Boston Globe because of the way it was referenced, and I forget who exactly wrote the article. But there was a study that was done since the onslaught of the COVID-19 in regards to alcohol. So there was an increase in the alcohol intake of people during that period. So I realized that people, like, you know, they might be dealing with, you know, people that have died, like grieving or loss of work or whatever. So how do we cope with COVID-19 in a constructive way? Because these people, like if they're addicts or something, they're going to end up in our hospitals, you know, that are already overflowing. You know, and on top of that, we have like the opioids. Some cities. Yeah. So I'm just wondering how we can deal with things a little bit better.
Yeah. Dr. Hebert, I wonder if you can weigh in on that question from Lana, which is really about, you know, how to deal with the stress in the face of the ongoing pandemic.
Lana, thank you. This is a very important question. We talk a great deal about resilience, just on an average typical day. You know, what are the things that you can handle from an emotional and psychological perspective from a standpoint of the stress that you're dealing with? You bring out an excellent point that not only has COVID pushed many of us closer to that line where perhaps we don't have control of our situation anymore, but when we look at a lot of the political challenges we've had over the last 5 or 6 years, those things have also added a great deal of stress. And I'll go back to what Bill asked about earlier, wildfires and the storms and that sort of thing. So what are the things that you can do to be more resilient? Some things that the experts say is exercise is very important. Just getting out for a walk, perhaps at a time of the day that fits your schedule. A person's faith life, no matter what wisdom, tradition, or religion you follow, people who have a strong faith life often are able to deal with stress in a much better way. If you have the good fortune of having connections with someone who is a counselor or perhaps a pastor, being able to talk things out with people certainly helps. And if you're in a relationship where you're able to discuss those things that are causing you concern, those relationships, having good relationships, can make a huge difference. And the last thing I'll mention is to connect with other people. Isolation, the fact that people are dealing with loneliness, and that increases during times like these, means that there's going to be a great deal more stress. So finding ways to connect with others, whether it's in your family unit, whether it's within your community organizations that you belong to, reaching out really helps a lot. But that's a great question, Lana.
Yeah. All right, Dr. Hebert, thanks so much for that. Jean, who do we have next?
Our next caller is John from South Carolina.
Hey, John, welcome to the program. Go ahead with your question.
Yeah, thank you. I had a question just about the booster shot. What can you tell us about those? When should we get them? Why we should get them? Yeah, and when will they be available?
And when available. Okay, Dr. Brooks, can you help us out with some questions on boosters?
All right. Yeah, John, that's an excellent question. I think that's one of the questions of the day. Let's make a distinguishing note between boosters and an additional shot. So people who need an additional shot is 28 days after the first one, and that is for those that are immunosuppressed. That has already been determined. That's about 3% of the population. The term booster means that you had immunity, and for whatever reason, there is a need to boost the immunity. Children, when they go to kindergarten, get their booster shots. Okay, that's just a requirement for kindergarten in most states. So that's the concept. As of now, the ACIP nor the FDA has given full approval for a booster shot. So honestly, right now, we're putting the cart in front of the horse. There will be a meeting on these issues, or this issue on the booster shot, probably in the next month or so, probably less than that. And the determination will be made. If there is the approval, and recommendation is even a better word, for a booster, it would be, and it's only for the mRNA vaccines, the Pfizer and the Moderna, it would be 8 months after you got your second dose. So this is more or less where we are at this point. I don't know if there's any more that I can speak on right now that I should speak on, but I think that it's important to understand that as of now, there is no formal recommendation for a booster dose. And lastly, I'll say for the J&J vaccine, J&J vaccine came to market approximately 3 months after the mRNA vaccines, the Pfizer and the Moderna. So there's no data yet to determine whether or not if you got the J&J vaccine, you will even need a booster. So John, that was an excellent question.
Yeah, and John, hang with us because I have a few other questions related to boosters in our next segment. So just hang with us, and we will get to those. And I want to thank our listeners for all the questions. We're going to take more of those questions shortly. And remember, to ask your question, press *3 in your telephone keypad now. And if you'd like to listen to this program in Spanish, press *0 on your telephone keypad right now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Okay, so Dr. Brooks, let's dive into boosters a little bit more. I know this is top of mind for a lot of people, and we've been receiving a lot of questions on this in recent weeks. So I'm going to run through 5 questions. And so maybe you can give us some fairly quick answers to each one of them. So I know that you had just prefaced your comments about boosters with the fact that they haven't been approved for use yet. But do we expect that someone will be able to get a booster earlier than 8 months, which has been the timeline we've heard so much about?
Right. So what will happen with any medication, if it's FDA approved, the physician can use it, excuse me, quote unquote, off label. But right now, the thought is it's going to be 8 months after your second dose. Someone could theoretically get it, but the problem with doing that is if there's no data that shows that that's indicated. And so if there's some type of untoward reaction, there's no good coverage for the physician who would have done this. And for the patient, you receive the vaccine outside of the formal recommendation. So I would say right now there's no data even say you need to get it prior than 8 months. So my recommendation is, assuming that it gets approved, that I would follow the recommendation, which is likely going to be 8 months after your second dose.
Okay, and when can we expect to hear a formal approval related to boosters?
I would say in the next couple of weeks, next 2 to 4 weeks.
Okay. Now, the Pfizer and Moderna boosters, would they be compatible?
So the general recommendation for almost all vaccines is to complete a series with the same one. And that will be likely the recommendation for the Pfizer, BioNTech, or Moderna vaccine. However, importantly, if the one that you got is unavailable, or you just don't know which one you got for whatever reason, the booster dose, when indicated, could be either of them. So that would go with the one that you got. But if you don't know if it's not available, get whichever one's available.
Okay, and is the booster the same potency as those first two shots?
Right now, it seems to be, but again, that'll be the data that will be reviewed by the FDA and the ACIP, the Advisory Committee on Immunization Practices of the CDC.
Oh. Okay, so then is there anything we can say about side effects? Would those be similar to the original shots?
Well, what we've been seeing, that the data showing that people that got a third mRNA vaccine, the side effects were similar to that of the two-dose series. Fatigue, pain at the injection site were the most commonly reported side effects, and most of the symptoms were mild to moderate. So the side effect profile seems to be about the same as with the first two doses.
Okay, and then finally, what do we know about boosters for folks with the J&J, the Johnson & Johnson vaccine?
Right, so I touched on that. So again, remember, the reason that people need boosters is because the immunity seems to wane somewhat from the first two for the mRNA. For the J&J, we just don't know. So I'd say if you got the J&J vaccine, just kind of be patient, because first, that means you got it later because it didn't come out till March. So your immunity is still there. And so as the studies come in, as soon as there's more information on the J&J immunity and the longevity of that immunity and the need for a booster, that we will review that information and make a recommendation.
Okay. All right. Well, we'll keep an eye on things over the next couple of weeks and see what the FDA panel is going to say about boosters. Thanks so much, Dr. Brooks. I'd like to bring Dr. Hebert and Chester Elton back into the conversation, have each of you respond to this next question. An AARP study found that most working caregivers are worried how they will manage everything when they return to work. They're worried about leaving loved ones at home, and that flexibility during the pandemic will be taken away. What options do they have for caring for their loved ones when they return to work? And what should someone do if they're experiencing stress or anxiety about returning to work? We touched on that a little bit before. Dr. Hebert, do you want to kick us off there?
Thank you, Bill. I think that the real gift to this panel is that we're all supporting a lot of the good science that's out there. You know, Dr. Brooks talked a little bit earlier, again, about the importance of being vaccinated. If that caregiver is vaccinated, then they are going to be much, much less likely to bring something from work back to a loved one that they're caring about. The Delta variant has shown that there is a greater chance than has been in the past with the original strain of the virus. But the things that we can do, again, I'm echoing what Dr. Brooks said earlier, and that is wearing masks, hand washing, distancing, being aware of testing protocols that are happening within the workplace. All of those things will mean that you're going to be safer coming back to that loved one. Another thing is the work setting varies. If it's someone who's working in a professional role as a formal caregiver, a nurse, or working in a healthcare setting, then those are things that need to be considered with regards to the increased risk. On the other hand, someone who might be working outside, who is in a place where they're not in tight quarters with other people, would have less risk. So it varies depending on where that informal caregiver or family caregiver is working.
Okay. Chester, how about you? What options do people have for caring for their loved ones when they return to work?
I think it's so important for you to have protocols. Just like doctors, when they go in to have surgery, there's a routine they go through. And we've talked about this with the other two doctors, and I think it's really important. What are your protocols? Wash your hands, wear your mask, do the social distancing. If you've got good protocols in place and you're keeping yourself safe, you're in turn keeping everyone else safe. And again, I can't stress enough, get as much information from your employer, as much information as you can as to the setting, the protocols for the entire team, the entire workplace. And I think a lot of it, too, is, again, if you're commuting, if you're just driving in, that makes it pretty simple. I live near New York City. Sometimes it's the drive to the train, through the train station, train, So the subway, the other, there's a lot of motion in there. So get your protocols straight, get your rituals, if you want to call it that, straight, and make sure you're doing everything to keep yourself safe so that you keep everyone around you safe. And I think that lowers a lot of your own anxiety. You know that you've done everything required of you. That makes sense, don't you think?
Yeah, it sure does. And Chester, you've talked already a lot about increased stress with the anticipation of returning to work. Do employers anticipate an increase in mental health struggles in the workplace once folks return to the workforce? And what steps are they taking to prepare for that?
Oh, absolutely. I mean, it's already happening. You're seeing, listen, my co-author, Adrian Gosk, and I, we do a lot of executive coaching as well. And this is mental health in the workplace. If it's not their top issue, if it's not number one, it's 1A. And so you're seeing a lot more employee assistance programs, really encouragement there. You're seeing Walmart, for example, has made mental health their number one issue. So they're doing training, they're doing counseling. They even did a thing. It was kind of fun. They gave everybody a free download of an app, a meditation app. And that sounds kind of funny, and yet, personal rituals of meditation and eating right and getting sleep and exercising, some of the things we've talked about, I think are very, very important. So absolutely employers are seeing the uptick, whether they're staying remote or coming into the workplace. And you're seeing a lot of businesses take a very proactive approach to that. My son works at American Express, for example, in the city, and their hotlines and their information lines and their websites of their employees all about when are we going to expect you to come back to work? Here's what it's going to look like. And we've heard it before too, different parts of the country are going to have different protocols. If you're in a state with low vaccination, the protocols are going to be different than if you're in a state with a high level of vaccination. So if employers aren't displaying that kind of thing, they're going to be more and more rare. It seems to me like every company of any size knows that mental health is going to be their number one issue. And of course, if you're worried about your health, if you're anxious, if you're stressed, you don't give good work. You can't be innovative. You can't be giving the levels of service that you want to your coworkers and your customers. So, long answer to a short question. Yes, is the answer.
All right. Very good. Thanks for that, Chester. Really appreciate it. Now it's time to address more of your questions with Dr. Oliver Brooks, Dr. Warren Hebert, and Chester Elton. Please press *3 at any time on your telephone keypad to be connected with an AARP staff member to get in the queue to ask that question live. Jean, who do we have next on the line?
We have quite a few questions on YouTube and Facebook, so I'm going to use one from YouTube from Martin. And Martin's asking, what's the recommended timing between a flu shot and a COVID booster shot?
Dr. Brooks, can you handle that?
Yes. So initially, we were wanting at least 2 weeks separation from any vaccine and a COVID-19 shot, but that was primarily to be able to determine side effects. And if you got a flu shot and the COVID-19 vaccine, how would I know if the fever was coming from one or the other? The recommendation now is there need to be no separation. They can be co-administered. So when you go in for your flu shot, if you're unvaccinated, you get your COVID-19 vaccine also.
Okay, very good. Jean, who's up next?
The next caller is Lori from Maryland.
Hey, Lori, welcome to the program. Go ahead with your question.
Thank you for taking my question. My question is this. My mother is 95 years old, and she has a caregiver who comes to her house that is vaccinated, but she has 2 young children that go to a public school, and they just returned to school. And my concern is the Delta variant, and how protected can my mother be with this woman who comes and takes care of her?
Interesting question. Dr. Hebert, can you weigh in on that?
Yeah, I'm happy to. Lori, I'm living with my 89-year-old mom right now. And Mom just got news that she has 2 new great-grandchildren who are going to be cousins born on May 1st. So all of these grandchildren, great-great-grandchildren that she's having, certainly are part of the issue for those of us that are caring for our parents who are aging. The first thing I would say is kudos and bravo to the caregiver who's vaccinated. Unfortunately, a lot of people working in these roles still choose not to be vaccinated. So wonderful that your mom has this caregiver who's vaccinated. Following the protocols, even after vaccination, is a really good thing because the masking, the hand washing, the distancing, those things are very important. So I would suggest that caregiver, even though she's vaccinated, because of the fact that she's with children, but just in general, it's good for her to wear a mask as the caregiver, wash her hands frequently. There are aspects of caregiving that can be done outside. My daughter is a nurse practitioner who works in a home care setting. And when all of this first happened, she said, "Dad, what do you think?" And I said, "Gee, if you can visit on the porch or the patio, those are some things from a caregiving perspective that help to reduce the risk." So, again, great that the caregiver is vaccinated. There's still a lot of good precautions that you can take that are well documented out there. Thank you.
Do you think Lori, with her 95-year-old mom, should ask the agency for a different caregiver, or do you think that the kind of precautions you just described would be sufficient?
I think that, you can certainly have that conversation, Lori. Whatever makes you comfortable as the family member, having that conversation would be important. I would think that this particular caregiver, she's a good fit and a good match for your mother. And you are perhaps taking on a new challenge if you get a different caregiver who doesn't have children, but maybe might not be as good a fit. So it really is a balancing act when it comes to the caregivers that are coming into the home setting.
Okay. Dr. Hebert, thanks so much for that. Jean, let's take another question.
All right. Our next caller is Shahir calling from California.
Hey, Shahir, welcome to the program. Go ahead with your question.
Hi, Bill. Thanks for taking my call. I'm an insurance agent and getting ready for AAP, and part of that process is I have several community meetings scheduled. The setting is in a closed room within a restaurant, and my question for your panel is this. We're expecting somewhere between 15 to 25 people to attend this meeting. My partner and I are both fully vaxxed. We wear masks. My question is it safe to be in that kind of a setting with, say, 15 to 25 other individuals, and we don't know if they are they have their vaccinations or if they're going to wear their masks or not? And can we ask them to wear their masks?
That's a great question. Chester, I wonder if you could address that.
Absolutely. Listen, in business settings, you can absolutely, put the rules in place as to when they come. If you feel like it's going to be a fairly confined space, you can say absolutely and pass out masks at the door. Look, we've been living with the virus long enough now that those simple things, I'm about to get on a plane late this afternoon. Everybody wears a mask. That's the deal. If you get on the plane, you wear a mask. So, just set it up the way you want people to feel safe and you feel safe. And having masks at the door, having some disinfectant at the door, say, welcome, here's your name tag, put a little dab of disinfectant on their hands. Say, gosh, we really love you being here to keep everybody safe and to keep you safe. We'd really appreciate if you wear your mask. You keep it in a really positive vein that you're really doing it for them to keep everybody safe. And you know what? More often than not, and I'm convinced well over 90%, people appreciate the fact that you're looking out for them. There'll be those rare people that will, cause a bit of a fuss, and that's okay. They don't need to come to the meeting, right? For the good of the people in the meeting. Set it up, make it really positive, position yourself as an ally. Hey, we're in this together. I'm looking out for you. You're looking out for me. You'll have a great meeting. It'll be great.
Great. All right. I love that, Chester. Thanks so much. Let's take another question.
Our next question is coming from Bill in Georgia.
Hey, Bill. Love your first name. Go ahead with your question.
Okay. I had COVID, but I've also been fully vaccinated. And I wondered how much immunity is conferred by actually having COVID versus the immunity you get through the mRNA vaccination.
Dr. Brooks, can you answer that question for Bill?
Yes, Bill, that's, first of all, thank you for being vaccinated, and sorry you got COVID. There's been a lot of data coming out, and some actually may be a little conflicting. The data that I saw showed that you have waning or lowering of immunity after getting COVID. I've also heard the other side that COVID may confer excellent immunity. Natural infection generally confers excellent immunity. That really doesn't seem the case overall. But the key is if you had COVID and then you were fully vaccinated, and there's no clear data for me to speak on, but you probably have a very strong immunity to the virus. So I would say this for me, answering that question, for those that have had COVID, I still recommend, and it is recommended, that you get fully vaccinated.
Okay, thanks so much for that, Dr. Brooks. Who's next on the line, Jean?
Our next caller is Joanne from Delaware.
All right. Joanne, welcome to the program. Go ahead with your question.
I have in-home caregivers, and I'm wondering about, I know that when you go out, you're walking where people have had COVID have walked. When they come into your home, should they take their shoes off? Like they could take their shoes off at my front door.
Right. Dr. Brooks, do you want to weigh in on that? What kind of precautions should Joanne and others ask visitors to take when they come to her home?
Well, my mother had a caregiver, again, the 95-year-old mother. When the caregivers came, they put the little booties over their shoes. But that was not for COVID. I think that was just for general cleanliness. So the experience I have is that is a standard practice. I think that's not unreasonable. To answer her question more directly, there is little evidence that covering your shoes makes any difference. COVID is not, generally speaking, on your shoe. It's a respiratory virus, and you have minimal to no risk of spreading COVID by someone wearing shoes versus not wearing shoes or taking them off into your house.
Okay. Thanks very much for that, Dr. Brooks. Jean, who is our next caller?
Our next question is actually coming from YouTube, and the question is coming from Hero798 and wants to know how to find out if your healthcare provider is actually vaccinated. Is there a way to do that?
I would imagine so. Dr. Hebert, do you want to weigh in on that?
Bill, thank you. And Hero798, that's a great question. My mother actually receives home health care. And I actually asked the admitting nurse whether she was vaccinated or not. So you can certainly just ask the question. Another thing that you can do is to call the company if it's a formal caregiver that's hired. Most of the companies will not let you know whether that person's vaccinated or not. But the fact that you're asking the question, you can make a request that the person who's coming out to the home to care for your mother, to care for that older person, or to care for you. You can make that request that they send someone who's vaccinated.
Right, or ask for somebody else. Okay, thanks for that, Dr. Hebert. Let's turn back to our expert panel for a moment. Dr. Brooks, despite evidence to the contrary, some pundits and politicians have recently blamed unvaccinated African Americans for the latest surge in many states. How do you respond to those remarks?
Okay, Bill, interesting. Okay, I would say this, the rate of vaccination is somewhat lower in African Americans than the general population. Approximately 50% of whites would say they're fully vaccinated versus 40% of blacks. So that's a big a difference. However, African Americans are only 12% of the population. So you're talking about a small, relatively small population. So there is that disparity. And in other data, there was from the Kaiser Family Foundation, 70% of whites said that they already got vaccinated versus 65%. So the differences in the vaccination rates are not that great. So I would say that I don't think that information is accurate. I would also say, and you said disproven, the other thing is that the way that this Delta variant is spreading is not, well, it's partially obviously vaccinated versus unvaccinated, but mask wearing is huge. So if everyone wore a mask, 100% of people, and they were around other people, then you would have less spread. And the data shows that mask wearing has become partisan. The data shows that majority of Republicans never wear a mask versus the majority of Democrats do. So honestly, here's the way I really look at that. And well, lastly, I'll say 57% of the population in the United States are white, okay, unvaccinated. So again, here's where we go with all of that. All of that is more or less irrelevant, and this is why. The only way we're going to get to the other side of this pandemic is for us to get vaccinated and us to follow infection control, which is mask wearing. But there's a third element. Tate, the movie War of the Worlds, when we were being attacked by aliens, we all came together. We're talking about the 20th anniversary of 9/11. When 9/11 hit, the world came together in support of the United States, our adversaries, if you will. Russia and China, I think, sent good, positive messages. The last thing is the only way we're going to get to the other side of this pandemic is to work together. To come together as a nation, not Baltic states of whites, blacks, poor, rural, whatever. That's not going to work. This is a worldwide pandemic. It's getting worse right now as opposed to getting better. And so I think that we need to think beyond that. Ultimately, if someone said that, their next statement would be to me, well, how do I get more blacks vaccinated? That's what I would want to hear. Yeah. Because as opposed to if they really felt that way, the answer is not to point fingers. The answer is to make the problem better. It's a non-issue, but the deeper concern in that statement is the partisan divide, individualism, the lack of cohesiveness. We got to get past that or this pandemic will not go away.
Okay, thanks for that, Dr. Brooks. Dr. Hebert, I want to ask you a question that's really been on the minds of a lot of our listeners. As COVID cases increase, nursing homes are limiting activities and reducing visitations. It's a huge setback for families. How can you remain connected with loved ones, and what advice do you have for families in this situation?
Bill, it was a real challenge back when COVID first visited us and the separation that family members experienced. Since then, we've learned a lot. We've learned that we can connect through FaceTime, Facebook Messenger, Zoom, Skype. We can place phone calls on a regular basis. I mean, I sort of got a kick out of one of the workshops that I did, use the acronym POTS, plain old telephone system. So making phone calls. The other thing that I would suggest is when you do make those phone calls, consider the possibility of having a more focused conversation. Certainly just want to check in and see how things are doing. But what I've learned in my experience with my mom, who's 89, is, asking her a question. We happened to be together for Dad's 15th anniversary of his death, and we remembered that. So I asked her about her memories of that whole experience. Dad had dementia for 7 years, and we were able to care for him at home that entire time. So I think that a more focused question, using some of the technology that's available. And another thing that I would say that's really important is if you have a family member in a nursing home, do everything that you possibly can to show your face frequently. When we're not in the midst of COVID time, being able to visit often gives you an opportunity to have some face time with some of the staff. Building a trusting relationship with staff ahead of time is helpful. If you haven't been able to do that and you're not able to visit, finding a way to try again perhaps through some of the technology to build a trusting relationship with staff members, and that'll help you to have a easier time connecting with your family member.
Okay, thanks for that, Dr. Hebert. And to our listeners, AARP has a tremendous resource that you can use. It's AARP.org/nursing homes. There we have a nursing home dashboard with data on vaccination rates among staff, and other data from particular facilities. There's also information on that site about questions to ask your nursing home or assisted living facilities. This is time to be a real advocate for your loved ones, and you've got a lot of tools at your disposal. So check that out, AARP.org/nursing homes. Thanks to each of our experts for answering our questions today. This has been a really informative discussion. And thank you, our AARP members, volunteers, and listeners for participating in the program today. AARP, a nonprofit, nonpartisan organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of the Q&A event, can be found at aarp.org/coronavirus beginning tomorrow, September 10th. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you'll find the latest updates as well as information created specifically for older adults and family caregivers. We hope you learned something that can help keep you and your loved ones healthy and safe. Please join us again September 23rd at 1 p.m. Eastern Time for another live event answering your questions about the coronavirus pandemic. We hope you can join us. Thank you and have a good day. This concludes our call.